Good afternoon, everybody, and welcome to this week's update on our risk and indicators for events and festivals. This is the second blog we're doing, and we're doing this on a weekly basis to enable event and festival organisers the opportunity to look at where we are within the county in terms of the key risk indicators that we're looking at from a public health point of view in terms of COVID and COVID rates. And the idea of this is to give you an opportunity to see where our direction of travel and the viability of events as you are planning them over the coming weeks and months ahead. Just to remind everybody, we have a series of public health indicators related to festival and events. They're broken down into a number of areas, but predominantly we're looking at what the direction of travel is in terms of our coronavirus rates, and we're looking at that both locally and across the county as a whole. We're looking at the rates in our more high prevalent groups, so the over 60s, and particularly in terms of our hospital capacity as well, and what the demands are in terms of our hospital capacity. And we're also looking at vaccination rates across our first 9 priority groups, and to ensure that we are following those trends and identifying any new or emerging variants that may be impacting on our communities. Delighted that Gemma from Public Health has been able to join us today, and I'm going to hand over to Gemma so she can share some of the current trend data with you.
Brilliant, thanks Jonathan. Let me just share my screen. Okay, so yeah, good afternoon everyone. My name is Gemma Stainthorpe and I am Health Protection Programme Manager at Warwickshire County Council, and I work in the Public Health Unit. So just starting on our initial list of indicators that we're looking at regarding festivals and events, I've got here the rolling rates per 100,000 population of positive COVID cases. So we're sort of looking towards the right hand side of the timeline now, coming into the end of March, beginning of April. So if I just hover there, you've got the different colours here for different district and boroughs. For example, North Warwickshire in pink, Nuneaton and Bedworth in purple, etc. They're all highlighted there for you. So just to kind of come to the first indicator, which is we would like to be seeing under 50 per 100,000 in Warwickshire, and then a sort of downward trend. So if we look at the Warwickshire average at the moment, it's coming in at 45, which is under 50. We can see this nice downward trend here carrying on, which has been largely progressing since the big wave in January. Sadly, we did have a little bit of a peak in Rugby and North Warwickshire, potentially linked to schools going back, certainly in Rugby area, but that looks to be coming down again now. So just looking at that, we can see the Warwickshire average, and then it's broken down into district and borough. When we're considering district and borough area events, we'd be looking at that local area of being 75 or under per 100,000. And we've got here, for example, North Warwickshire coming in at 93. So that's the highest coming in there. So would be treading with real caution there and perhaps be looking at that one at the moment and putting some questions to that. But we can see the others are coming in, you know, under that 75, so that's really good. Okay, so that gives you a general indication of those. One of our other indicators looks at our cases in 60 plus, mainly because you know, COVID cases within that age category have proven to be you know, potentially more dangerous and than other age groups. So if we look at this trend again, we've seen this nice downward trend coming in from January again, and coming down really quite into low figures now, which is brilliant. End of March, beginning of April, looking at real sort of single figure cases coming in averagely, which is great. So I shall just stop sharing my screen and pop back to Jonathan. And that's just to give a starting overview.
Thanks, Gemma. Just helpful to know where we are in terms of vaccination rates at this moment in time. How are we looking across the 9 category groups?
Sure, thanks, Jonathan. So obviously our vaccination uptake, we're looking for 90% and above in those groups, especially when thinking about future events coming up within the summer months. So I can tell you that in the 80+ age category, we have an initial uptake of 96.4%. In the 70 to 79 age category, we have 95.6%. And 60 to 69, we have 91.8%. And then 50 to 59, we're coming in at 86.8%, so getting nice and close now. The lower age categories, we haven't quite got that data yet, but that will be coming through in time.
Okay. In terms of hospital pressures at the moment, reports from my hospital is that some of the pressures that they were seeing earlier in this calendar year have definitely eased. The ICU beds are certainly not the capacity levels that they were a few weeks ago even, so they have been reducing, which is good to hear. In terms of new variants, as we reported in last week's blog, there are 2 variants which we're keeping an eye on, both of which have been around for a while. Obviously, the Kent variant is the one that has impacted most across the region, and Warwickshire's not been immune to that. And there's also been the South African variants as well, which at the moment has been contained in fairly isolated areas, and we've not seen any major impacts on Warwickshire in terms of the South African variant, but that's something we're keeping a very close eye on. So in summary, if you are looking to hold an event this week or next week, based on the data that we have at this moment in time, we would be highlighting to event organisers that the rates in the north of the county, particularly in North Warwickshire, are higher than we'd like them to be. We'd have some concerns if events were being held there at this moment in time. The rates have been on a downward trend, but there was a blip a couple of weeks ago, probably connected to school and community transmission that tends to have been contained within school age population. We've not necessarily seen it spread within a wider community at this moment in time, but it's something we're keeping a very close eye on. But the direction at the moment is downward, and that would be the trend for us. So if it was, if you were planning an event particularly aimed at a younger age range, then again we would probably put more scrutiny on that event right now because of that transmission within that age range. But on the whole, the rates are going in the right direction, which is very positive. So we hope that's helpful for everybody. And as always, you're very welcome to contact us if you'd like further information. So big thank you, Gemma, for joining us today. And we'll keep everybody updated in next week's blog. Thank you, everybody.
Thank you.